Right now, there is an urgent call for help. The Red Cross is saying they are dealing with yet another blood shortage brought on by a surge in COVID-19 cases. Joining me now to talk about this, Maya Franklin with the Red Cross of the Greater Carolinas. Maya, it is great to have you on. How bad is this shortage?
Well, this is the lowest donor turnout, the lowest blood inventory that we have seen in about 6 years. So it is significantly impacting our ability to provide blood to hospitals for patients who need life-saving transfusions.
Those numbers, as far as this being the worst that you've seen in 6 years, is that specific to the Carolinas, or are you speaking on a national level?
There's a 10,000 unit shortage of blood donations, and that affects us nationally. As the Red Cross has a national inventory of blood, anyone who donates blood here locally in the Carolinas, in the Greater Carolinas region, that blood has the ability to be distributed to hospitals near and far, wherever it's needed and whenever it's needed. So it's really a privilege for us to be able to have an inventory that can support people locally and beyond.
I know that we did report on a shortage in July. I want to clarify, this is different than what we reported on in the summer, correct?
That is correct. There are a couple of other factors that contribute to the current shortage that we're experiencing. Normally, the fall is a time when we see an inventory, a blood inventory rather, that really supports the needs of our hospitals and their patients because we are able to collect blood in schools, at high schools, and at colleges. But this fall, we have been impacted not only by COVID-19, but people returning to in person learning because of the Delta variant and an increase in cases. Additionally, people are returning to the workplace and they don't have that flexibility in their schedules to be able to donate blood. Businesses where we may have collected prior to the pandemic have really limited their access. And so we are unable to collect blood donations with a lot of organizations that we did prior to the start of the pandemic.
Has there been a lack of education as far as people being concerned about potentially catching COVID if they were to show up to one of your clinics and donate blood?
It is important that people know that we are adhering to the highest safety standards for individuals who are donating blood. We do require that individuals wear masks as they come to donate. We also are still cleaning the surfaces that donors are touching. We are still social distancing, still 6 feet apart, whether you're at a donation center or at a blood drive in the community. And also, you do not have to be vaccinated to give blood. We will ask about your vaccination status, just ask about the manufacturer that you got the vaccine from, but you do not have to be vaccinated to donate blood. We just ask that you are feeling well and wear a mask at the day and time of your donation.
Who is hurting the most from the lack of supply that we are seeing? And two, how are hospitals coping with this?
Well, the patients are really the ones who are at the greatest risk if blood is not available. If there's a traumatic accident that happens, if there is a mother who needs blood because she's experiencing complications during childbirth, if there is an individual who needs platelets as part of their chemotherapy treatment for cancer, those are the individuals who are at risk. Hospitals are in a really compromising situation at that point when there is not blood available on the shelves. Sometimes they do have to delay surgeries and different procedures. So we never want to get into a situation where doctors are having to tell patients that they have to wait. And sometimes that does happen, but we don't want that to happen frequently. We don't want that to be the norm.
Who's the ideal donor at this time? And are you looking for all blood types, or is there one specific type that is needed the most?
There are blood types that are at critically low levels, and we're talking about less than a day's supply of blood. One of those types is type O negative, which is the universal donor. It's important because it can be transfused to a patient of any blood type, whether or not doctors have time in an emergency to type a patient's blood. But of course, every donation, every blood type is valuable. Every donation matters, and it counts towards someone who needs that life-saving transfusion. You could always be a match. Again, we are asking for anyone who is healthy, and 16 years old with parental consent, weighs 110 pounds, feeling well on the day of their donation, and really just has that kindness in their heart and willingness to give to donate blood at this time.
You answered my last question. What do people at home need to know? Is there anything that I left out that you'd like to add?
I would just strongly encourage anyone who has ever considered donating blood to do so at this time. If you are ineligible for whatever reason, whether it is your age, if you have been deferred before because of other circumstances, please try again or spread the word. Ask your loved ones, your family members, your friends to donate blood and to help others in it.
All good information there, Maya. Thank you.